Since you learned that you are living with multiple myeloma, you have probably talked to your healthcare team about which treatment options are best suited for you and your current situation. Of the available treatments for newly diagnosed myeloma, high-dose therapy followed by stem cell rescue, commonly referred to as autologous stem cell transplant, may be an option for you. Although this is called a stem cell transplant, there is no actual organ removed from a donor and given to a recipient. Stem cells, also referred to as progenitor or master cells, are found in many of your body's organs, such as the bone marrow. Stem cells are unique because they are partially developed cells that can then develop or differentiate into over 200 other different types of specialized cells with useful functions in your body. There are two main approaches to stem cell transplants: autologous transplants, where the stem cells come from your body, and allogenic transplants, where the stem cells come from a matching donor such as a relative, usually a brother or sister, or sometimes an unrelated donor. The most commonly used treatment approach for newly diagnosed transplant-eligible people is autologous transplant. In myeloma, allogenic stem cell transplant is still considered experimental. In both cases, the process involves treatment with high-dose chemotherapy to destroy myeloma cells, and some healthy cells in the process of doing so. Then, stem cells are reintroduced to provide your body with a new source of healthy cells. There are 7 steps involved in autologous stem cell transplantation: evaluation, induction treatment, mobilization, stem cell collection, conditioning treatment, stem cell rescue, and recovery. The first step is evaluation. Before you undergo an autologous stem cell transplantation, your healthcare team will conduct a thorough assessment of your health and various factors related to your disease to determine whether you are a good candidate for this kind of treatment. If you are a good candidate for transplant, the next step is to reduce the number of myeloma cells in your body and bone marrow. This is done with a combination of medications and is referred to as induction treatment. Induction also prepares you for the next step: mobilization and the collection of your stem cells. During mobilization, medications are used to mobilize the stem cells to move out of the bone marrow and into the blood. Next, your stem cells are collected from your bone marrow or your blood. The stem cells are collected using a process called leukapheresis. After the stem cells are collected, they are frozen and stored for later use. The next step is referred to as conditioning treatment. You will receive high-dose chemotherapy that kills as many of the remaining myeloma cells in your body and bone marrow as possible. One side effect of this treatment is that it also destroys the healthy cells in your bone marrow. Next is stem cell reinfusion, sometimes also called stem cell rescue. A few days after high-dose chemotherapy, the frozen stem cells are thawed and infused back into your body to help jumpstart your body's production of new blood cells. Within a few days, the stem cells make their way into the bone marrow, where they start to produce new blood cells and begin to repopulate your bone marrow. The final step is recovery. After your transplant, many people feel tired, weak, or nauseated for several weeks. Depending on the hospital, you may begin your recovery either there as an inpatient or in your home as an outpatient. As an inpatient, the average hospital stay is 4 weeks. As an outpatient, you would be required to have a 24-hour caregiver, keep a daily record, and visit your treatment center's outpatient transplant day hospital regularly to track your recovery. The full recovery period can last several months, but can vary greatly from person to person. The first few months are the most difficult, as you may continue to feel weak and fatigued. You will have to be extra careful to avoid infections during this recovery period. Your transplant team will review all special precautions you will need to take during the first few months after your transplant, such as washing your hands before cooking or eating, cooking foods thoroughly, and avoiding eating raw foods. These precautions will help ensure a good recovery. About 3 months after your transplant, you may be offered maintenance therapy, a prolonged, low-dose form of treatment given after an autologous stem cell transplant. The goal of maintenance therapy is to prevent or delay disease progression for as long as possible while maintaining the best quality of life. There are, however, some disadvantages associated with maintenance therapy, such as potential side effects, treatment costs, and increased frequency of doctor visits. Talk to your healthcare team about the potential risks and benefits associated with maintenance therapy so that you can make the best possible decisions. Stem cell transplantation can ultimately reduce or eliminate the symptoms of multiple myeloma. While it is a long and challenging process, it can help you get back to doing the things you enjoy and make you feel better for some time. Your healthcare team has helped many people with stem cell transplants, and they will use their experience to support you throughout the process, answer your questions, and share with you what they have learned from treating others. Here are some tips to help you throughout your myeloma journey. Ask your healthcare team questions if you're unsure about anything related to your myeloma, treatment, or symptoms you are experiencing. Make sure you have someone with you during your appointments to support you and help you absorb and write down information. Consider keeping a diary to track what's happening and how you're feeling. Ask about participating in a support group, in person or online, where you can talk about your experiences, and take good care of yourself, making self-care a top priority. For more information on stem cell transplantation, visit www.myeloma.ca and download Myeloma Canada's High-Dose Therapy and Stem Cell Transplantation Info Guide.